Today, my guest is Jenny Jobson at the Midtown Assistance Center in Atlanta. The center was founded in 1986, and it brings together outreach efforts from churches around the Atlanta area. Before COVID-19 hit, Jenny worked with and oversaw a pretty large group of volunteers that worked at their offices assisting clients in need of support with rent, food, and just other necessities. When the pandemic started to take a hold in Atlanta, it became clear that for the safety of the volunteers and their clients, they would need to take everything remote. Jenny talked with me about the quick changes that they made, how they will affect the business in the long term, and what their plans are for the future. Here's that conversation. Well, hey, Jenny, welcome to the show.
Thanks for having me.
You are very welcome. So when the threat of COVID-19 kind of hit, at this point a few months ago, it seemed like everybody was, transitioning obviously to work from home. And I know that y'all are traditionally all work in the office folks. So what were some of the first steps that y'all took to kind of prepare your staff for that transition process?
Yeah, it happened so quickly. We have all sorts of procedures in place for various situations and circumstances, but I don't think anyone, at least we didn't, had a playbook to follow for a pandemic. So when we started hearing about COVID-19 and we knew it was flu season, we were taking extra precautions to disinfect the office every day because we have so many clients coming in to visit our office for assistance. And then we have a team of volunteers working with us every day. So we wanted to keep everybody healthy. But I think the real emergency that we were going to need to limit the number of volunteers that came in and transition staff to home happened pretty quickly. I was in talks that week with some fellow providers who are partners in outreach ministry throughout the city of Atlanta. And we were all having these discussions about how do we best serve our client population, and then how do we keep our staff and the people that we serve and our volunteers safe. And so I think we'd had several conversations the week leading up to Friday the 13th. And by that Thursday, we realized that we were going to have to cancel all volunteer activities. Which is a huge part of what we do. Our volunteers are really the face of our service. Mm-hmm. While people are screened over the telephone by a staff member, it's our volunteers that provide that direct one-on-one personal contact, which is so important in the work that we do. And so to have to tell them, many of whom are retired and fit that initial demographic that could be potentially at risk because of age and health issues, to tell them that they couldn't come in was a really hard decision, but one that we knew we had to make. These are people that are so committed to service that regardless of the risks that might have been presented, they still would have shown up for work. So having to tell them and knowing some of them weren't happy about it, we did that on we did that on a Thursday, and I had 2 staff members out of the 7 who potentially could fall into the risk categories at that time. Mm-hmm. And so that Friday, thinking that we were looking at helping flatten the curve, I asked them to take home Chromebooks and some of the office supplies in the office, but not really realizing that this would just go on and on. I mean, it was March the 13th that our entire staff and the last group of volunteers were in the office, and they've not been back.
Did you see a drop off? And because, if a lot of your staff is volunteer, and also in that older at-risk demographic, did you see a drop-off in the amount of volunteers that you had at your disposal during this time?
A few of our volunteers that fall in the risk categories that had spouses or household members who fall in that risk category had notified us probably the week before that they thought they were going to need to take a break for a couple of weeks until this COVID crisis passed, to help flatten the curve and not overload the hospitals. And that was all what we were all focused on. And then I realized there were 2 staff members that probably needed to work from home. So that Friday, mm-hmm. I mean, really with little warning before they left, it was, okay, let's box up some supplies you would need over the course of the next 2 weeks and a device that you could work on. And just having no idea. I think if someone had said to me that Wednesday, hey, you need to transition everyone to working from home for 90 days or longer, that would have been a task that would have been just really hard to tackle. I think the fact that we were looking 2 weeks at a time made it seem doable. It's like, well, of course we can
Yeah.
still communicate with our clients, push off assistance, do some of the assistance remotely. We can figure this out. So some of our staff came back that Monday, and we worked
Mhm.
Monday, Tuesday, and Wednesday, thinking that we could keep our team in the office, a small number of our team, through the 2 weeks, but then realizing that for safety reasons, we
Yeah.
were going to need to transition everybody at home. So our whole team has been working from home since March 19th. And
That is crazy because I've had a
really just
remote
scrambling.
team for years. Like we've always been 100% remote. And so I can't fathom the change of pace for a company that's been around for a while,
Right.
working from the office, very high touch, having to transition within 24 hours. I don't care what it is, a 24-hour transition time for almost anything is hard in and of itself, much less completely altering how you work and who is working, the whole thing. So tell me a little bit about that during that 24 48 hours, what were some of the first processes that you put in place to kind of help ease that transition as much as possible?
Right. Well, our demographic group for staff, we bridge age wise, someone that's recently graduated from college who serves as a full time volunteer to a staff member that is retired, has retired, and this is a second career. So we're broadly cover all sorts of demographics and capabilities as far as technology. Fortunately, in 2017, we had transitioned our client intake process in the office to a digital process where instead of giving clients paperwork, we were giving them iPads to enter all their
Oh
information.
yeah. Mhm.
Um, Works with our Salesforce system, so that's how we manage all of our client data. I knew that within 24 hours we could still call clients using our cell phones, um, contact them via email, schedule appointments, and continue to do the financial piece of what we do, which is primarily paying rent bills, utility bills, to prevent disconnections and evictions. And we
Yeah.
knew that people were starting to be told that they can't come into work. And so, for the population that we serve, they're working paycheck to paycheck usually with no paid time off. So, we knew this was going to be an immediate crisis for them. And we could see that part of it coming, but realizing that we were going to have to do it remotely was something that we just sort of worked through. And our process has changed from March 19th to the way that we're doing it now. It's much more efficient. And there's definitely so many silver linings in learning to work remotely, thinking that working remotely doing emergency assistance was not going to ever really be an option,
Mhm.
except for maybe, a couple of days a year to work from home to finish a big project. But to actually interact with
Yeah.
clients remotely, I had not considered that as an option. But now I see that this will be how we operate in some part into the future.
Mhm.
Not always needing someone to come into our office. Um, their time is when people are working and they don't get paid time off, their time is extremely valuable. And that's
Oh
something that
yeah.
you try to respect. So knowing now that we can actually very efficiently assist them remotely, and so they won't have to take time off of work to come get assistance. This will be a process that we continue into the future when there's a vaccine for COVID and we're back in the office and we have a new normal. We've learned a lot of new skills and
Mhm.
processes that we're going to be able to use. So I'm trying to see that as our silver lining,
Oh
even
yeah.
we, desperately miss that important human contact that we have with people that are in need for our services and the volunteers that serve with us and our staff members. Everyone really misses that interaction.
It's amazing how like such a bad time can obviously force you to make a change that you didn't think that you could make. So stretching kind of those boundaries of what you thought was possible. But in the long run, you're actually able to help serve your clients and your customers better and more dynamically over the long run. It's like you said, time is valuable for these people.
Yes,
And
absolutely.
so now by allowing them to do a lot of this stuff virtually, you're giving them time back. I wish I could have some time back or
Right.
some extra time in general. And so because of this bad situation, you're now set up for the long haul on serving your clients better than you ever had before now.
Absolutely. It's really interesting because in the office, we would traditionally have them come in with a list of documents, and they would come in with paper documents, which we would scan into their record as documentation for various grants for assistance. Well, we were running into this problem over the course of the last year where so many people were coming in with their cell phones, and they don't necessarily have a device at home, but most people have some type of a smartphone, and everything is on that smartphone. So they would come into the office and say, well, I've got my lease and I have my documentation of income, but it's all on my cell phone. And we were always trying to figure out, how do we get it off the cell phone and get it emailed into the office? Well, now we've updated our electronic client card, which we now can email to folks, and they can complete it and send all those documents as attachments off of their phone, and it goes into our system, which makes, even if they're going to come in for an office appointment, they'll be able to do that in advance.
Yeah.
And it'll just make assistance a lot more smooth. And then when we're in the office, we'll be able to really focus on just spending that one-on-one time, listening to their stories, which is really important.
Oh, yeah.
And being able to provide assistance.
Now that you've been apart for a while, have you started thinking about what a potential comeback plan looks like? I know that working from home is going to be a part of that plan.
It is.
But what is kind of your outline for, let's just say, obviously tomorrow is not going to be the day, but if tomorrow is the day that, we're greenlit to all kind of get back to doing what we were doing, what does that look like for y'all?
If tomorrow was the day, and our board and our team is really paying attention to the numbers, our local numbers in Georgia. And so when the numbers start to trend down and it seems like it will be safe is when we'll return to the office. But we'll return to the office with part of our staff. And so we'll have rotating staff. We'll have some staff that'll be working remotely as a team, and then other staff that will be in the office. As many people as we can assist, if this were to happen tomorrow, that we can assist remotely, we'll continue to provide that remote assistance. One of the big things that we do, and it's so important, is hunger prevention. And so food insecurity for people that have no income, that don't have access to the grocery store. We've had a food pantry for 34 years that has met that need by providing physical food for people to take home. And so closing our food pantry, I think, was the hardest part of all of this. It was really a gut-wrenching decision, but knowing that it was important to encourage people to stay home. So we had always kind of envisioned this idea of doing food delivery and using Instacart to do that. And so pretty immediately we started, and initially it wasn't so easy because grocery store inventory wasn't so great.
Yeah.
And so ordering an Instacart delivery, you might have to set it up several days in advance, but that's actually improved as stock in grocery stores has gone up. But
yeah,
we've been sending Instacart deliveries directly to people in need, especially folks that are in high-risk categories, the elderly. And then the Instacart shopper sends us a picture of the food on the person's front step or at their front door. And so we're able to meet that need. That's something we're going to continue because until there's a vaccine, we don't want to encourage people that fall into the risk population to come into our office and potentially be exposed. So we're going to continue doing the Instacart deliveries. We've also been mailing grocery store gift cards because people need things in addition to food. They need cleaning supplies, which have been hard to come by, paper goods, diapers. Those will be things that we continue to do, but we're hoping that when we can transition a few people back into the office, that our pantry can be open on a limited basis for people that really just need to come in and get food and to get food quickly.
And I know that's awesome that you're partnering with Instacart. Where is kind of your delivery radius that y'all are working to help people within?
Sure. So our service area, even though we're Midtown Assistance Center, we've been Midtown Assistance Center for 34 years, and Midtown has changed significantly.
Just a little bit, yeah.
Our service area has changed so much, especially over the last 20 years. So we do a lot of assistance in Southeast Atlanta. And if you're familiar with Atlanta neighborhoods like Old Fourth Ward, Sweet Auburn, that area, Grant Park, Lakewood, in the beginning, or I guess it was more spring of last year, but we officially added 2 new zip codes that were underserved but large zip codes of need. 30318, which touches Midtown and West Midtown, and it goes all the way out to Bankhead Highway. And then also 30310, which touches the West Side and extends down down towards southwest Atlanta. We added those two zip codes because there's not a lot of resources for folks there. And we'd identified that as Midtown becomes less affordable, folks are having to move further away from the city center. And those
Yeah.
were the areas that we were getting requests for assistance and knowing that there weren't a ton of resources. So we can send Instacart deliveries, all over the city pretty much. But that's kind of our radius is 10 zip codes that sort of surround and then grow out from Midtown and downtown Atlanta.
That's awesome. If anybody was interested in volunteering and actually helping out with you guys, what are you looking for in terms of help?
Yeah, so right now that's staying connected to our volunteers. I mean, they've been one of our greatest resources because they were doing the face-to-face delivery of assistance, which currently is not an option. Working in our food pantry is not an option. But our volunteers have been writing note cards, just inspiring note cards to our clients that we then include a MARTA card for them to get to and from work, Kroger gift cards so they can go to the grocery store. But instead of just putting that in an envelope and mailing it, we've got our volunteers are handwriting these encouraging messages to give somebody, to let people know that they're not alone, that even though we're not physically present in our building, we are still there for them. And the responses that we've gotten through email from the clients just about those notes, that it's not more than just a gift card or a MARTA card that they got in the mail, that was like this little line of hope that they got, and that they knew that they weren't alone, and how it lifted their spirits. So that's something I'm just a big fan of handwritten cards. And so a lot of our volunteers have felt really engaged by doing that, writing notes to clients. We've got people that have been making masks. Because when we're back in the office, we'll need to make sure that everyone's wearing a mask. We're going to start actually mailing them to some of the clients that have expressed a need, that they don't have access to it, and that a reusable mask would be helpful. So we have got a church that made a bunch of masks for us that we're going to pick up and start sending those with the gift cards and the notes. So that's how we're engaging people now. Our volunteers are like family. They commit to coming in and serving. Some come every week, come the same day every week. And so we've been doing Zoom meetings with them on their assigned volunteer days so that they can stay connected, because those personal relationships are so important when you bring a group of diverse people together who share that goal of wanting to serve people, even though their backgrounds may be different, their ideologies might be different. It's a really strong and powerful bond for friendship. So a lot of our volunteers, they'll meet up on Zoom every week, but then they're also doing social distancing, meeting in the park and going for a walk.
Yeah, that's awesome.
Stay engaged because we miss them so much, and we're working through trying to figure out the best way to put their hard work to use. But right now, those gift cards or the note cards have been really important and meaningful to the clients that are receiving them, but also to our volunteers who are writing them.
I know that when I receive handwritten notes in the mail, that always makes me super excited, because somebody put time into that. It's just not a copy and paste email that was mass sent out to 20 people. Like, somebody took time, they got a stamp, they licked the envelope, they closed it. Like,
right.
There was time and effort put into that. And that goes so far, especially, when we're increasingly getting disconnected.
Exactly.
And so it's a wonderful thing. So to kind of wrap things up, what is something that you would like to leave our listeners with today?
I think, and it's not really related to COVID, but just I've been at Midtown Assistance Center for 22 years and first started as a volunteer, and just wanting people to realize that you can make a difference, that you could be the voice, that it's important to speak up and be a voice for people who maybe have not been traditionally heard. I've seen groups of people with little or no training do amazing, amazing work and amazing things, both at Midtown Assistance Center, through other volunteer work. I was involved with a group that traveled to Haiti, and we were just a group of 7 people back about 25 years ago. And now that's a nonprofit that supports a medical clinic to a very remote village in Haiti. And no one really had any special expertise, but just a willingness to make a difference. I've seen parents with children with serious illness be able to advocate and raise funds that have changed the course of treatment for pediatric cancer and will change and save lives. I mean, people can make a difference. If you're passionate about something and you're willing to speak up and do some work, you can make a difference, and don't ever underestimate your ability to do that, I think is what I would want to leave people with. You might not think that just one person can make a difference, but one person definitely can, and then a collective of multiple people can really transform community.
That is amazing. Well, Jenny, thank you so much for spending some time with me today. Is there a good way for people to get in touch with you? In case anybody
Yes.
was interested in learning more about what y'all do?
Yep, we have a website, which is midtownassistancectr.org. We're also on social media on LinkedIn, Instagram, and Facebook and Twitter as the MAC Atlanta. So the MAC Atlanta. And you can find us and follow along. We've got virtual book club going on where we're reading books and discussing them over Zoom. So we've got
Nice.
one next month. We're going to read and discuss Them, which is a book that was written about. It's kind of historical fiction that takes place in Old Fourth Ward, which is one of our service areas.
Nice.
So yeah, we've got a lot of trying to still connect virtually and advocate for the people that we serve in our city.
Wonderful. Well, Jenny, thank you so much for joining me today. I really do appreciate it, and I look forward to chatting with you again soon.